Welcome to the Flex Forward podcast, where grit meets growth. With your host, Nic Espanet, bringing you stories of resilience, reinvention, and the real climb to success.
All right, everyone, welcome to the Flex Forward podcast. Today, we're joined by Joseph Perlman. Joseph is a plastic surgeon and owner of Advanced Plastic Surgery. Joseph, glad to have you today. Can you let our listeners know a little more about what it is you do, a little more about yourself, and a little more about Advanced Plastic Surgery?
Sure. Good morning, Nick. Thank you for having me on. I am a board-certified plastic surgeon based in the Houston area in the northern suburb called the Woodlands. I've been in practice 42 years, was an assistant clinical professor of plastic surgery at Baylor, and have been in private practice now since 1987, and have primarily been doing cosmetic surgery over the last 20 years. My practice is primarily, I do a lot of facial surgery. I do more facelifts, I believe, than anyone in the Houston area. We also do some breast surgery. The most common procedures among cosmetic plastic surgeons are cosmetic and reconstructive breast surgery, as well as liposuction. But I do facelifts, eyelids, nasal surgery, and so on.
Very cool. And you mentioned something before we got started about some regenerative medicine division that you started. Would you like to talk about that?
Yeah, I have started to get into regenerative medicine because I noticed about 15 years ago that a lot of my patients, and most of my patients, 95% are female, they were on antidepressants and anti-anxiety pills. And I thought it was kind of strange that many were on. And the reason was that a lot of my patients, like myself, were baby boomers, the ones that I did breast augmentations on in the 1980s. I did tummy tucks in the 90s, and now they're getting into facelift territory. So a lot of them have either were going through menopause or had gone through menopause. And in the 1980s and 90s, to treat menopause, doctors were using a medication called Prempro, which was Premarin, which was estrogen from pregnant horses combined with a chemical lab-made progesterone called progestin. And 30% of those women were getting strokes, heart attacks, blood clots in their legs. So the gynecologist quit prescribing it. Well, the patient still had the symptoms, and Big Pharma took the opportunity to introduce things like Lexapro, Wellbutrin, Prozac, and all these medications. So they were treating their symptoms, but not really treating the menopause. Then I started to look into bioidentical hormones, and we've been doing bioidentical hormone therapy since 2005, and naturally got more into other regenerative medicine, including peptides, stem cell therapy, exosome therapy. And we're just trying to make people live happier and healthier lives by changing the way they do things. But so it works as a natural complement to my cosmetic practice.
That's awesome. I mean, it's great you saw a need that your patient population was not having met. It looks like you guys have come in to try to help serve them in a healthier way than just, like you said, putting a Band-Aid on the problem and not fixing the problem.
Well, we're living longer. You know, it used to be in 1920 versus 2020. In 1920, the average woman didn't even make it to age 60. So you didn't have to worry about menopause in a lot of these patients.
Oh,
now the average woman is living to 82, the average man 78. So we're living longer, but we have a lot more inflammatory processes that are a problem. And so they've coined the term inflammaging, that you age because of these different chronic inflammation problems that are going on. So we're helping people address that with hormone therapy, trying to get their diet properly. We're doing food testing and gut testing. We're doing brain testing. We're doing a lot of different tests to see what we can do to individualize their healthcare so that if they're going to live longer, they might as well live healthier. I mean, we would all like to live to a certain age and then just die in our sleep. Doesn't quite happen that way, but we that's our goal.
Yeah, I read an interesting book, Outlive Peter Attia, that talks about.
Oh, sure.
You just don't want to you don't want to live to 100 and be stuck in your bed. If you're going to live, that's way out there, but live a longer life. You want to have a quality in
Yeah.
those extra years that you have. And so that was very eye opening. I read through that book, and he had a ton of research in there along some of the same stuff you're talking about.
Well, and the other issue is that I just read an article about the fact that caretakers are becoming few and far between. There's 10,000 people in our country turning 65 every day. And a lot of those people, and when I grew up, my mom lived in a 6-block area from where she was born to where she died. And we had our grandparents live with us. And there was a lot of 3-generation families. So you had someone taking care of you when you got older. Now we're spread out all over the country. I got a brother in Florida, a sister in New York, a brother in Chicago, another brother in another part of New York. My mom lived in our hometown, but there was no one to take care of her. So you'd have to travel if you wanted to, God forbid, fortunately, she passed away and didn't need a nursing home or needed extended care. But that's the issue. And so you hire caretakers. Well, a lot of these caretakers are Filipinos or Jamaicans, and they're having trouble getting into this country, or they have to be in hiding and so on and so forth. And I read where the cost of daily healthcare on someone with Alzheimer's disease not daily, but yearly in a nursing care facility is $288,000 a year.
Wow.
Who has the money for that?
No, that's extra. No one. That's that's like you said, more and more people are aging. We're going to see more and more of that, and have those needs, and that's something to think about, because we do scatter with grandparents, and having those multiple generations where grandma or great grandma may come live with somebody and help care for is much.
We don't see it anymore.
Correct. That's interesting.
Alzheimer's is another issue. There's about I think about 8 or 9 million people in the United States with Alzheimer's, and that number is going to double by 2050. Wow. So that's another issue we're dealing with, is the dementia issue. And we first of all, we don't know what causes it all the time. There's some genetic issues where you can test people genetically, but there's also a lot of other issues that can influence it, including vascular issues and so on.
No, that's one. It's good that you're looking at trying to help some of your patients avoid some of those things where they have a better quality and don't need that care as soon, if at all. But well, it sounds like a lot of competition within the medical profession or in plastic surgery. What is something that has set you apart in your practice and helped you to have some of your successes?
Well, I think a lot of it has to do that, as you had mentioned, we're in a service industry. Houston itself has 4 medical schools that have plastic surgery residency programs. So they are graduating 10 to 12 plastic surgeons just in the Houston area every year. And there are probably 500 plastic surgeons in town. Plus you have ear, nose, and throat doctors that do cosmetic surgery, dermatologists. You even have emergency medicine doctors that do it. So there's a lot of competition. So the key is not only to provide good service, quality service, but be available to patients. One of my professors, Dr. Spira, he was chairman at Baylor. He said you have to have the 3 A's. You have to be affable, you have to be able, and you have to be available. And that's what the patients want. So when we see patients, we make sure we take time with them. We don't have a mill where we run them through. We take the individual time. So then when we follow them up, I call them the night of surgery to see how they're doing. I give them my cell phone number. I say, call me if you have any questions. When we have patients that just drop by our office just because they happen to be in the neighborhood, and they just come by and say, I just want to come by and see you and tell you I'm doing great. Or we'll run into.
They feel welcome. Yeah, it sounds like you make them feel welcome, or they're okay stopping by.
Yeah, and they run into us at the restaurants, and they'll say things like, I still do great. I know you don't remember me from 20 years ago, but, and I don't remember them, but, it's nice for patients to tell us that.
Well, and that's great, because as business, you want referrals too. So they're feeling welcome and welcome enough that they're probably going to let their friends and family know, if you need this service, this is a physician to go with. And that,
that's so true.
Nice for referrals.
True. Houston's a city of transients. There's a lot of people moving in here and moving out. So it's not as if you develop a long-term relationship with your neighbors. Your neighbor may be there this year and he gets a corporate transfer to the West Coast. So a lot of patients will find their doctors on Google. And in which case you have to advertise on Google. You have to have a good social media person working with you. But I would say that at least half of our patients are referrals from other patients, which is to me, the more important thing, because you can always post if you go on any plastic surgeon's website, they're only going to post their better results and their great pictures. Sure. And the young plastic surgeons coming out are more slick. There's some that come out and they hire a marketing team right out of their residency program. When I was a plastic surgeon going into private practice, as pretty much all plastic surgeons did, you covered a bunch of emergency rooms. You got a good reputation being able to come in, treat people, and you built up a practice that way. And then you started to get the cosmetic patients. Now these kids come out with a marketing team. It was funny. There was a plastic surgeon here in the Woodlands about 10 years ago. He finished his residency, and the next month after his residency, he was in the local magazine and had a full page ad as the Woodlands premier plastic surgeon. And he hadn't even done anything yet. So you can get fooled by what you see in the advertisement. So having someone who's board certified, number one, and number two, someone who you can get some reviews from, and also if you personally know someone who's been to the doctor. I've had patients that say, "Can I talk to one of your patients, your previous patients?" I said, "Well, I'll call them, and if they're willing to call you, they'll call you anonymously. They don't know your name, and then you can talk." And I tell my patients to be honest with them, and let them know how your experience was.
That's awesome, and having that refer, I think that having somebody that will call and talk is so much better than a billboard, a magazine ad, even a review online. But having somebody that will personally say, "Hey, we highly recommend Dr. Perlman. We've had this great experience with him," just goes so much further. And having somebody having comfort with utilizing your services.
Yeah, and it's important that you individualize the care for the patient, because there's some people who come in with a preconceived idea of what they want, and it may not necessarily be the most practical thing or the best thing for them. As one case, I had a woman come in, she wanted a breast augmentation, and I always ask them, "Well, why? What's your reasoning behind why you want the breast augmentation?" And her response was, "Well, my husband's having an affair with his secretary, and she's got big boobs, and I want to have bigger boobs." And I said, that's not the issue. That's not going to help anything. So you have some patients like that. Then you have some patients that have what they call body dysmorphic disorder. They are constantly picking on small things and wanting to tweak this and wanting to tweak that. And you have to kind of pull them in. When you first start out as a plastic surgeon, you want to get experience and you want to make some money, and you probably take on more cases than you should. As you get older, you get wiser, and you know when to say no to patients. And I think that that's an important thing. Sure. With dealing with someone who's got experience. Like I said, I've been doing this 42 years. So you have someone, and I've seen it all. I've had some patients, and one of my professors said, there's always patients that you wish you could take that case back and probably done it a little different. You'll never do the perfect case. And sometimes we're our worst critics because the patient's totally happy, and I'm looking and like, well, I could probably tweak that a little more. And so I think that that's important for me to always try to do the best job that I possibly can. And at the same time, we also have to be realistic that the human body's not, when you're cutting skin, you're not cutting a piece of wood. So it doesn't heal, and everything's doesn't mend the way you plan it.
Yeah, it's not going to reset the way, it doesn't do the same exact thing every single time. Like,
right.
Everybody's bodies are different. Their inflammations are different.
Right.
Their recovery. It could be one patient follows your your recovery or like rest or whatever it is they have to the T. The other one may go out and run the next day when they're not supposed to, or something like that. That's gonna you lose control once they leave the door and not.
That's exactly true. And the other thing is, a lot of times, they may have a little problem with the way the incision healed, or they'll say, well, could you do a little something here? And we always offer to do a little revision in the office. Usually those are done under a local, and it's not a big deal. The whole goal is to make the patient as happy as you can make them within reason.
Sure. Good stuff. So if someone's listening and wants to get better at something, either self-improvement or their business, have you found anything that you like to listen to or that you can suggest to our listeners?
Well, the American Society for Aesthetic Plastic Surgery and the American Plastic Surgery Society have websites that offer a lot of information for patients. My own website has information for patients, and those would be the premier choices. A lot of people go on what we call Dr. Google, and they get a lot of misinformation. And so we have to kind of wind them back, pull them back in and say, well, that's nice to hear, but that's not how it really happens. A lot of people make extraordinary claims that they can't really back. So our goal is to be realistic with patients on what can be accomplished. You can't promise these people. Some people say, well, promise them this with the idea that it's probably going to be better. But, we try to not discourage patients, certainly, from their surgical procedures if it's indicated.
Sure. When it's being realistic, but not giving an unrealistic expectation. I would imagine that for any, especially physicians, Google or people look at, they come in with some bad advice and that's contra. So you guys probably spend a little more time or a lot more time, saying, disproving some things people may have looked up online. It's good to be educated, but you can get a lot of misinformation online also.
Well, that's true. And if someone comes in and they're 60 and they bring in a picture of themselves when they were on the beach at age 25, can I look like this? Not really. I'll tell patients I went to medical school. I didn't go to magical school.
Just having that reality.
You have to. And most people are. I'd say most people that we treat are realistic. They come in with a certain goal in mind. It's interesting. I don't treat that many men. Most of the people that get cosmetic surgery are women. And the women will come in, and I've had women with 4 pages of questions, and they're checking them off as they ask them. And then I have guys come in with a checkbook and just like, here's the check. Just do what you need to do, and tell me when I'm getting operated on. So
tell me when to show up.
Yeah, just when to show up. So it's how you have to individualize everybody.
Yeah, it's getting to know people. So, through your career, what's one of the biggest challenges you've had to overcome?
I would say one of the biggest challenges is not trying to, or expecting every case to be perfect. And that's within me. We try to make every case as good as possible, but you can't make every case perfect. You can't make everyone happy. Even people who have a great result, sometimes they're not going to be happy, and you just have to understand that. You'll have patients, you do a facelift on them, and they come in and they say, oh, my face looks great. Everybody loves my face. And then a month later, they'll have run into a girl who they don't like anyway. And she says, oh, you look terrible. And then they come back in and now they're like, God, I look so horrible. And I'm like, 2 weeks ago, you said it was the best thing you ever did. So you have to deal with people's psyche. And sometimes that can be challenging. But other than that, I think overall, the practice has run pretty well. I can't really complain. I'm very thankful to the staff I have in my office now. Is probably the best staff I've ever had. They're very good with dealing with the patients because, as I said, these patients need a little more individual care. They're not someone who looks your name up in an insurance book and knows that you're booked 3 months out. So they can go to any plastic surgeon, and it's a cash business. So we want to make sure we provide as good a service as we can and then make them as happy as we can.
That's awesome. Well, it sounds like things are going well for you and your business, and it's people start having success. They start looking to the future and consider passive income, either to supplement or maybe replace your income at some time. What are your thoughts on passive income?
Well, the regenerative therapy business is something. I've hired a nurse, and she's been through the training to do the hormone therapy for us, and she's evaluating patients. I've observed her. She's following my protocols, and she has taken over that portion of the practice for me. The goal for me, I'm 76 years old. The goal for me is not to be depending on cutting for 5 years from now, even though my hands are steady and I love to operate on patients and I love to see the good results we get. At some point, you have to be realistic. You have to be that quarterback who's like, I don't want to play one extra season. I don't want to be that pitcher who pitches one extra season. I want to be that surgeon who quits when you're still at the top of the game, especially in our business, because you don't just lose a ball game. We're dealing with human lives and people's health, especially when you're dealing with faces. But we get good results. Our reviews are great. So the goal is to develop the Texas Institute for Anti-Aging Research portion of the practice, have my nurse run that with me supervising it, and allow my wife and I more time to travel, go to meetings, and just travel to other places around the world.
That's awesome. Exciting. So that kind of answers my next question. So as we're wrapping up the interview, what you have any exciting plans or initiatives in the works? But it sounds like you just answered that question with your regenerative medicine clinic that you kind of are kicking off. And
well, we do attend a lot of meetings related to business, and we every December the American Academy for Anti-Aging Medicine has a meeting in Las Vegas. But I'm also presenting at a meeting in Paris for the International Stem Cell Research Society in April. And so our next big fun trip, I think, is a cruise from Budapest to Amsterdam, going down the Danube River, then through a canal in Bavaria and hooking up with the Rhine River and ending up in Amsterdam. That'll be next year. We try to do bucket list trips every year. And so since my wife's bucket list was this year, and so mine will be next year. And so we kind of trade off like that. She wanted to always go to the balloon fiesta in Albuquerque. So we did that in October. And that was fun. That was really fun.
Was that I've seen pictures. That just looks beautiful.
It's more amazing in person. We took pictures, and the pictures don't really show you how it's just fascinating, because it starts before sunrise. They have a drone fest first. They have all these drones before sunrise. And then at sunrise, they send up a dawn patrol, which is 6 or 8 balloons to determine which way the wind's going. And then you see over the next 2 hours, you see about 300 to 400 balloons taking off in segments. And it's just, and you could stand there, you could go right to where they're all being launched. And it's just great. It's wonderful. They got rock and roll music playing, and it's great.
Oh, that sounds so cool. Well, thank you so much for joining us today and sharing some tips and insights with our listeners. If people would like to connect with you and learn, get in touch with you, what's the best way to do that?
Well, you can go on our website, which is my name, Joseph Perlman, MD, or drperlman.com, DOCTOR Perlman.com. You can also go on TIFAAR, TIFAAR.com. And that's our regenerative medicine practice. So both of those link, and we can send you more information. We have a lot of information we send by email, and we would love to hear from you. And thank you so much for having me on. And if you'd ever want to talk about other things, I was a physician with the Olympic team. I'm a physician for Live Nation, so I could give you some backdrops on some of the musicians, or what goes on when you're an Olympic physician. We can do that sometime too.
Yeah, that's awesome. Good. Yeah, good stuff. I'd love to learn more. I wish we would have gone down that rabbit hole a little bit, but awesome. What
that gives us another subject to talk about.
Exactly. Well, thank you so much, Joseph, and thanks everyone for tuning into the Flex Forward podcast. Be sure to like and share it with your friends and family, and we appreciate everybody tuning in. Thanks for your time.
Thank you.
Thanks for listening to the Flex Forward podcast. If you've got grit, growth, and a great story, visit flexforwardpodcast.com/guest to apply and join us on the show.